Hi there. Welcome to Mindfulness-Based Self-Care, Session 7. As a review, I want you to continue to remember the things that we talked about in previous sessions. You have been given both formal and informal practices to keep you in touch with your mindfulness, to keep you aware, to keep you thinking of the present moment, to help you to know your thoughts, to help you know how to come to a place of calm. And we've talked about bells in your life. Bells seem to be the hardest concept for people to grasp, but when you grasp them, suddenly many things can become bells for you. It's not just one bell, it can be many bells. For me personally, my examples of bells include times when I feel kind of a surge of anger. That is a bell in and of itself that tells me, take that breath, check into my body, check into my feelings, check into my present moment awareness, and bring myself to calm, perhaps patience, perhaps non-judgment, so that I can live mindfully. Another one of my bells is kind of an easy one, is the stop sign. I sit at the stop sign, take a breath, look around, see the trees, see the flowers. Or traffic jams, other good ones. One that I like to share with folks because it is kind of fun for me is when I'm walking my dog. And I may be doing mindful walking, or I may just be walking along with the dog. And she stops to pee. Oh, rather than dragging her from that spot or becoming impatient because suddenly we've had to stop, I thank her for giving me a bell that says, take a breath. Look up at the sky, see the clouds. Smell the air that's fresh, the trees. That's a bell. The phone is an obvious bell. And we can actually bring bells into our lives by getting certain apps on our phones. Again, not alarm clocks, but nice gentle bells that might even remind you on an hourly basis to breathe, to check in with your body and relax. Today I'm going to talk to you about the stress reaction versus the stress response. Our bodies are designed to automatically react to threats. We've talked about that. And those are primitive reactions to stress. And you've learned these probably, maybe years ago, as fight or flight. But they've also added freeze. That's that bunny that stops in the middle of the road, or the deer in the headlights. Fight, flight, freeze. And that way, in the old days when we needed to truly run, or perhaps save ourselves by fighting, or perhaps even be frozen in our spot so maybe somebody wouldn't see us. Those are very primitive and they're automatic. And they cause the body's organs and systems to respond as well. That is the response of adrenaline. The stress response pushes adrenaline into our systems. And our body systems then shift to survival mode. They don't shift in any way that helps healing. That shift is actually away from the healing mode and into the survival mode. Your body's job is to support healing, support health, heal itself. But stress goes totally against that. Threats can be perceived from the internal environment or from the external environment. There may be actual external stressors, external threats. But think about those internal threats that we listen to daily, those thoughts. Remember those negative self-thoughts that I talked about when we talked about judgment. So our internal threats come in the form of thoughts and our perceptions and our inability to use some of those attitudes that can keep us mindful and calm. So we tend to become our own worst enemy with our judgmental thoughts, with our strivings. Remember this whole idea of non-striving? We don't want to be striving, although our society has encouraged us. So just being is very difficult in our society because striving has been ingrained in many of us. And that striving causes the stress response. So our impatience also, and our reactions are what support that stress response. But researchers have noticed, and they've taken note on this, many doctors haven't necessarily caught up with some of this, but given the same stressors, many individuals display different bodily reactions. So everyone does not respond to stress the same way. So everyone doesn't need the same therapies, the same medicine. Our stressors and the way we respond to them tends to be modulated by the way the individual responds to a situation, responds to something that happens. It's an individual response pattern rather than a reaction pattern. So our stress, way that we react to stress, is often reactionary. What we want you to do is learn to respond to stress. So there is a difference in the actions of react and respond. Reactions are often learned from old patterns of coping, from childhood learnings, from childhood socialization, from conditioning, from our attitudes as we've developed through our lives. These set up ourselves, our internal selves, for reactions from past experiences and challenges. Reactions tend to be unconscious and automatic. We are often unaware of our reactions. And as we've talked about before, mindfulness is about awareness. So the more mindfully we can become, the more mindfully we live, the more aware we can become and become able to respond. Because responses require a certain amount of conscious awareness. Decision making is part of this conscious awareness, to avoid or modulate this automatic tendency to react. Mindfulness makes awareness possible. Awareness is our goal, so that we are responding rather than reacting. We are aware moment to moment. This is our goal. Moment to moment awareness. And our awareness helps to slow down our immediate reactions to things. It can change our reactions to responses, to healthy responses, to responses that acknowledge some of the attitudes we want to develop in our life, like being non-judgmental, like being with the beginner's mind and learning from others, like being patient. We can decide to respond based on our attitudes. Non-judgment, trust, letting go, acceptance. So, how do you deal with these particular things that I'm going to suggest? Do you react or respond? And there's situations you may look for in your future to choose to respond rather than react. Okay, react or respond. Cut off in traffic. React or respond. Fail an exam. React or respond. Feel disrespected by a friend. React or respond. Finding out you're having to live with a chronic condition. Are you reacting or responding? Meet these situations with a breath, with your mindful attitudes, and respond. There is power in observing your emotions, and you will learn from them. In no way are we suggesting that you do not feel, that you get rid of negative feelings and negative thoughts and negative emotions that come to you, but rather observe them. Learn about yourself from them. Learn that you have the power to make choices, and those choices come from your awareness and your ability to observe your emotions. Do not deny them. They're very real, they're very important, they're part of who you are. Look at them non-judgmentally, observe them, learn from them. It is important to understand that we have to acknowledge thoughts in the present moment without holding their impact in your body. Because what often happens, check this out for yourself even. You may have a thought that you don't want to have, or a feeling that comes up. It may even bubble up when you're being patient and you're breathing and you're perhaps even attempting to strive for calm. You need to allow the feelings to bubble up, acknowledge them, and exhale them. Watch yourself when you're talking to someone. Do you stop, and are you aware that you might even catch your breath rather than express a feeling? Those feelings are coming up for a reason. It's important that you share them, important that you acknowledge them. If you don't, you're pushing them back down into your pressure cooker of a body, and the stress response hinders physical healing, hinders emotional healing, hinders spiritual and mental healing. Gradually, as you are more mindful, this mindless living on autopilot and reacting can be increased by your increased ability to choose your responses. This supports the freedom that you can develop from stressful patterns in your life. Those patterns that keep you feeling anxious, the patterns that keep you feeling depressed. You can make choices. You can choose responses. You can choose loving yourself. You can choose healthy patterns of thinking and coping. It will also help you to walk through your experiences, open to learn from them. Some of your experiences may be ones that you don't particularly like. What are you going to learn from them? You can walk through life, walk through your experiences with that beginner's mind, becoming aware of your automatic reactions, your automatic tendencies, and choose to make more healthy decisions that support your body's healing, support calm and relaxation. Those healthy decisions that support the relaxation response in your body that support your body's healing mechanisms rather than that old familiar stress response. This helps you to live in acceptance. It is what it is. When I can accept those things that I encounter, walk with an open mind, and be calm and breathe through all of my life experiences, I can live in acceptance. It is what it is. It is what it is. Remember, doing in mindfulness is not doing anything except breathing, accepting, loving yourself. As you continue to use your practices, the benefits do continue to increase. Although some practices may feel difficult and they may not resonate with you, such a practice actually might be a gift that you might be resisting. So you may want to look at some of those practices that are most difficult as the ones that might give you the greatest gift, if you are able to challenge yourself to use them. But whatever you choose to do, remember to practice, remember to breathe. Be aware of your formal and informal practices that we have shared with you. Use your journal. And there are tools of body scans, 20 minutes, 45 minutes, in your meditation journals, in your meditation area of this program. There are, I believe, 8 different meditations, and you can grow with these as well as simply sitting and being. So just sit and breathe.